This is West Point, one of Monrovia's slum areas. It's dawn and hundreds of women are here to get the drugs that will give them and their families 1 month's protection against malaria.
She said because of Ebola, no hospital open. So when the children get sick, what they do, they mash the pepper and then just pepper the children with it so that they can get well because there are no malaria medicine.
Over the next 3 months, 300,000 Monrovians will be given the drugs they need to protect them against malaria. These people live in the most densely populated and deprived neighbourhoods in the city. The programme is designed to prevent malaria and young children dying from the disease. However, early symptoms of malaria and Ebola are similar, so the aim is also to avoid people who think they may have hemorrhagic fever going to the Ebola treatment centres and risk coming in contact with infected patients. But organising distributions during an Ebola epidemic is not that simple, and care must be taken to ensure people don't get infected.
La première règle, c'est qu'on doit se protéger soi-même et toutes nos équipes pour ne pas être infectés. On essaye de faire des petits rassemblements de personnes, que des femmes, le matin à l'aube quand il n'y a pas encore beaucoup de monde qui est réveillé. C'est donc plus de 1000 personnes qui font la queue pendant 2 heures sans se toucher, sans nous toucher, donc un espace de protection d'1,50 m pour éviter un contact.
Similarly, another MSF team has organised the distribution of home protection kits, buckets containing protective gloves and masks and bleach.
Whenever someone is sick, I won't run away from them. I will be able to take good care of them.
Over 16,000 kits have already been distributed. The kits contain everything families need to protect themselves until the infected person gets admitted to a treatment centre. After months of rain, many of the track roads around Corema have turned into deep clay mud. But neither the sea, too dangerous, nor the rivers, infested with crocodiles, offer feasible alternatives. In such conditions, how can we reach out to remote communities and people who may be suffering from tuberculosis? MSF decided to trial an innovative approach and used unmanned aerial vehicles to send sputum tests for diagnosing TB to Corema Hospital.
The impact is to improve considerably and drastically the diagnostic capacity, to be able to react quickly and to have a clear idea of what is the situation for the person, even if she is or he is in a remote place far from any referral hospital. It's very new and it could be a real revolution for us in terms of effectiveness of diagnostic and system.
The use of UAVs is still in its trial phase. Operated using a smartphone, they are currently capable of travelling at a speed of 60 km an hour with a range of 28 km. The MSF team also works in Corema Hospital. The aim is to establish within 5 years an effective model of care adapted to the context that can then be replicated in other affected areas in the country. All the children who come to Conseguela Health Centre undergo the same ritual. They're weighed, screened for malaria, and their upper arm circumference is measured. Malnutrition and malaria are recurrent here, and they jeopardise the health of numerous children. The MSF team transfers the most critical cases for treatment at the hospital in Cutiala, the main town in the district. This little boy is suffering from severe malaria and needs a blood transfusion urgently. As these severe cases of malaria and malnutrition are responsible for the deaths of many young children, the MSF team has set up 2 preventive programmes for them. The first is the administering of seasonal malarial chemoprevention to protect them during the rainy season, and the second, the distribution of ready-to-use therapeutic foods to healthy children to prevent malnutrition. These initiatives have already helped thousands of kids to grow up in good health.